Greetings, everyone. I am Carolyn Emanuel-McClain, Chief Executive Officer with Rural Health Services here in Aiken. I wish I were there with you in person this morning. However, prior commitments have prohibited me from being with you as I'm in Chicago attending a conference. However, I am happy to be able to share with you today the vision of Rural Health Services. Community health centers across the U.S. provide preventive and primary care services to nearly 29 million people, and have continued to do so while facing a global pandemic. Last year alone, Rural Health Services was able to provide services to over 17,500 patients with almost 62,000 patient encounters. While our approach is community-based and local, collectively, community health centers are the backbone of the nation's primary care system and is the largest primary care network in the United States. Rural Health Services provides tremendous value and impact to the Aiken community, including jobs, economic stimulus, savings to Medicaid, and access to care for vulnerable populations. Now, let's talk about our future and where we are going. I'd like to address workforce development. We are in collaboration with Aiken Regional Medical Center, serving as a family medicine site for residents. We accepted our initial group of residents in July of 2022. In July of 2023, and in further conjunction with Aiken Regional Medical Center, we will accept the initial group of internal medicine residents. This is such an important program because it will provide us with a pipeline of physicians to serve the Aiken community. As you are well aware, we have physicians that are retiring, they're aging out, some are leaving the community. So we have a need for physicians, and this is just a great relationship because we are sort of growing our own now. These residents will they do go away to medical school, they come back, and they must do a 3-year residency. So we're that training site in conjunction with the hospital for this. In addition, we have signed agreements with University of South Carolina Aiken, as well as the Aiken Community College for RNs and LPNs to do their clinical rotations. That will provide us with nurses, again, a training ground to help to provide additional nurses for this area and hopefully to alleviate that shortage problem. With these additional training programs comes our need for additional space. After completing construction of the Clyburn Center at the corner of Teague Street and Columbia Avenue in 2015, we thought the 26,000 square foot facility would meet our future space needs. But within 2 years, we were looking at additional space to house some of our support programs. Needless to say, we didn't plan well for that one because the growth really exceeded what we thought we were going to be able to do. In 2016, we purchased a residence on Teague Street and had the property rezoned and converted into an office space. This was just the beginning of our next phase of expansion. I must pause here to say how grateful I am to Reverend Slaughter and the trip that we took back in 2011. We were meeting in his church and talking about some partnerships we could do together and what was needed in Aiken. And we took a ride in his car, and he rode me out and showed me some properties that Second Baptist owned on Teague and Columbia Avenue, and it was about 75 acres. And I was like, wow, that is wonderful. And lo and behold, I had no idea that we would end up with some of that property. But as fate would have it, the church did sell us some property that they had, as they had planned to build a church, and then they found additional property for themselves, and we were able to purchase the property that they had initially planned to build a church. So, after converting our last inch of storage into clinical space, Rural Health Services acquired an additional 5-acre tract of property adjacent to the Clyburn Center in 2020. We quickly realized that we needed additional space as the demand for integrated behavioral health increased and pediatrics was losing space due to an expansion of the dental clinic. We broke ground for the Women and Children's Center in October of 2021. Our OBGYN, mammography, and pediatric departments will relocate from the Clyburn Center to this new facility. And after that relocation, The space that was previously occupied by the pediatrics and OB will now be opened up to allow additional space for the family residency program for the second year of residence. We do expect our new facility for the women's and pediatrics health to be completed in June of 2023. We are also planning a facility to house our residency continuity clinic at the corner of York and Columbia Avenue. The target date for this project to be completed is June 2023 also. So we'll have two construction projects going on, our initial maternal and child health, as well as the residency continuity clinic for the internal medicine. To minimize our warehouse rentals, we are constructing a separate facility for maintenance that will serve as a central storage space. During the summer of this year, Rural Health acquired the balance of the real estate adjacent to the Clyburn Center for Primary Care, rendering a 32-acre campus. Other opportunities include construction of an auditorium to seat up to 200 individuals. That facility will be used for general staff meetings. At this time, when we have a general staff meeting, we go outside to rent space, and we think we should, again, have enough space to have our staff meetings on site when we need to. Hopefully this space will be available also to community groups of that size that may want to come in and have meetings. We plan to have a commercial kitchen attached to that, so that if there's catering or food preparation that needs to take place, that can happen. In addition to, we want to have space for specialty services. So there'll probably be construction of another facility that will house specialists that we will bring in for a day or two a week. There are certain specialties that we need for our patients. That's a barrier right now due to their, they've been Medicaid or uninsured. There's long wait times. And we'd like to be able to bring those services on site so our patients can get them in a timely manner. The next opportunity is daycare for our employees. Daycare is very important. When school is out, people stay home with their children. They have to miss work. As the majority of our employees are of childbearing age, I think this would really be a great recruitment and retention tool to have daycare accessible here at the site for our employees. We hope to be here to continue to serve Aiken, to be able to service, have the partnerships with the city, with the universities, with the hospital, all of our partners. We just want to work together to take care of this community. Again, that's just an overview of our vision for rural health services. Things are apt to change depending on what's happening in the environment. We are responsive to the community. I thank you very much for having me with you today to share with you our future plans, and I look forward to seeing you all again in the very near future in Aiken.